So good evening everyone, this is Dr. Vineet Sehgal and welcome to another session of Neuro Euro in Ophthalmology. Today we would be talking about the eyelid anatomy. So why the eyelid anatomy is an important topic for you. So when we talk about the various eyelid disorders, when we talk about the ectropion, entropion, we talk about ptosis, lag ophthalmos. So in all this we talk about the disorders of the eyelid. Sometimes we talk that where is your lid crease, whether this lid crease is present or not, let's say in a congenital ptosis. We also talk about where is the eversion, how much is the eversion of the eyelids. We talk about the inversion of eyelids. So when we do a surgery, which layers to be basically dissected and what are the various roles and the various pathologies that you can get in various lid disorders. To know that, it is very important that we go from the basics. Anatomy, which is basically a domain of the anatomist, but sometimes the eyelid disorders, they can have a subtle type of anatomical disorders which can be useful for you. So that's why I have made this topic of the eyelid anatomy a very small and short and concise topic which would be so much useful for you. You can see all my lectures on the Unacademy Learning app. You can download the Unacademy Learning app from the iOS store and the Play Store, where you would get the daily live classes, structured courses, live tests and quizzes, and the unlimited access to all the lectures. If you want the prep letter subscription also, you would get a iconic subscription where you would have an additional advantage of the video lectures and the rapid revision course and a lot of discounts which are there on the iconic subscription, and 1 month more subscription when you get a 3 month subscription. And you use the code OPHTHAL10 to get a 10% discount on any of the session or any of the course that you want. With this, I would be coming straight to our lecture, which is about the eyelid anatomy. So what is the basic function of the eyelids? Eyelids act as a shutter for the protection of your cornea. So let's say there is something dust coming inside my eyes. So to prevent this dust to basically touch the cornea and cause corneal ulcer or corneal erosion, we can close our eyes. Okay. And also it would basically decrease the impact of any trauma. Let's say I got a blunt trauma and my eyelids are closed. So this blunt trauma would basically have some dampening because of our eyelids. Our facial features are there because of our eyelids. So your eyelashes, how are your eyelashes, how is your lid crease, how much they are opening, this gives you a good look. Then another very important feature of the eyelids is that it basically helps to spread the tear film. When I talked about the tear film yesterday, I talked about the three layers, the mucus, aqueous and the lipid layer. So this mucus, aqueous and the lipid layer, it has to be uniformly spread over whole of the eyeball. So this work is also done with the help of our eyelids. If you can see, this is a picture of eyelids where you can see, if you can appreciate this crease, this is called inferior lid crease, and similarly you have the superior lid crease also. This is this area, the horizontal one and the vertical one. This is basically called palpebral aperture. I write it here. This is called palpebral aperture. Now, if you can appreciate here, the sides. Here we have the tendons which are attaching this eyelids to the bones. These are called medial canthal tendon. I write it as MCT here. And here is our lateral canthal tendon. Okay, I write it here, lateral canthal tendon. And here in the eyelids, we have the openings which are called the puncta. We have the upper puncta and we have the lower puncta, which basically goes towards your canaliculi. We have the upper canaliculi and the lower canaliculi, which basically join to form a common canaliculi, which open into the lacrimal sac and make the nasolacrimal system. So you see that the eyelids are not only just important for this, another important function of eyelid is it makes the first point for your nasolacrimal apparatus also. Okay, that is the puncta and the canaliculi start from your eyelids. Okay, then what are the various structures in the eyelid? If I go from the superficial to deep, if I go from the superficial to deep, the first structure is our skin, followed by the subcutaneous areolar tissue. Then we have the muscle which opens the eyelid. Okay, so which opens and closes the eyelid, which is called orbicularis. Then we have the orbital septum, orbital fat, retractors of the eyelid. We have the tarsal plate and we have the conjunctiva. The conjunctiva, which is basically covering the posterior part of the eyelid, this is called palpebral conjunctiva. Okay, so these are the various layers from the superficial to deep, and in very short we would be going to discuss these layers. So if you can see this first diagram, this is my eyeball. This is my eyeball and this is my inferior lid. You can see the eyelashes here. As I told you, the first layer, the superficial layer, is of the skin. Okay, so if you can see, this is the skin. I put it with the red color. This is the skin. Beneath the skin, we have a very important muscle which is orbicularis oculi. Okay, this is the muscle which is orbicularis. I just make it with blue color. Okay, then if you can see, this is this line which is basically dividing the eyelid into the anterior and posterior part. This line is basically called gray line. Very important, when you do a lid dissection, we should be knowing that whether we are basically in front of the tarsal plate or we are at the back of the tarsal plate. So remember here that the tarsal plate is towards the posterior side of the eyelid and it has the meibomian glands embedded in it. Okay, if you can see, I just make it with another color, let's say green. So these are the meibomian glands which are there in the tarsal plate. So see, we have the skin, we have the orbicularis oculi. So they would ask the structures which are in front. So this is the PGI question, structures which are front of the gray line. So our answer would be skin and subcutaneous areolar tissue and the orbicularis oculi. The ones that are posterior to the gray line, that are our conjunctiva, meibomian glands and the tarsal plate. Okay, then we have another diagram of the upper lid. In the upper lid, we can see here we have the septum. Okay, I would show you what is the septum, what is the tarsal plate. Just remember, the orbicularis is in front of the septum. Then we have the meibomian glands which are basically there in the posterior to the gray line. The glands of the Zeiss which open in the eyelashes. Okay, so we would basically, why these glands are important, because when there is a inflammation of these glands, whenever there is a pathology of the ducts of these glands, there can be internal or external hodulum. This gland, then these two glands which you are seeing, these are called Wolfram and the cross. So if you can see the Wolfram and the cross, they are very near to the conjunctiva and they are called accessory lacrimal glands. Sometimes they are asked as a question, what are the accessory lacrimal glands? Your options, the answer would be the glands of cross and Wolfram. Where is the main lacrimal gland? It is in the superior-temporal part of the eyeball. We have the lacrimal gland there. We basically discussed the lacrimal gland in our session previously. So remember, the accessory lacrimal glands are there in the eyelid. Then we have the two muscles, the ones which are retractors. This is the molars and the levator palpebrae superioris. So the ones which basically elevate the eyelid, they are your molars muscle and levator palpebrae superioris. The ones which close the eyelid, that is your orbicularis oculi. If it is clear to all of you, just give me a thumbs up. Chalo. Then we come to layer by layer. The first layer we talked about is the skin. Now remember, this skin is the thinnest part, or the thinnest type of skin which is there in the body. Okay, and because of its thinning, it has folds which basically lead to ease and the speed of mobility. Okay, so if you can see, this is just touch your upper eyelid skin and see how mobile it is. So why this is important is that you can open and close. If it is very stiff, then there would be difficulty in opening the eye. So that's why if there is a scar in the eyelid, the patient may have difficulty in closing or opening the eyeball. Similarly, if this skin is basically having some trauma, because of the very thin fold, it can basically tear very easily. So sometimes with even your blunt trauma, you can get a tear in the skin because it is a very thin portion, or it is a very thin covering over your eyelid. The second tissue is the subcutaneous areolar tissue. Remember, there is no fat that is there, so it is very easily distended by the edema or the fluid. Now what it means, let's say you have a allergy in the eye, okay, or let's say you are suffering from a chronic renal failure, or if there is a patient who is having a trauma. So initially, very early in the pathogenesis of the disease, you can have a lid edema. Okay, even if you get a blow to the eyeball, you can have the hemorrhage just beneath the skin, because there is very thin skin, and the areolar tissue does not have any fat, so everything can get accumulated there. That is the basic importance of the subcutaneous areolar tissue. After that, I told you the next layer is your orbicularis oculi. Okay, so the orbicularis oculi is basically the protractor of the eyelid. Okay, what is its main function? It basically closes the eyelid, and why it is important is it also is basically most important for the functioning of the nasolacrimal pump. It is very important for the functioning of the nasolacrimal pump also. So whenever there is a orbicularis oculi which is affected, which is sometimes affected in the seventh nerve palsy, I also called Bell's palsy. So nasolacrimal pump work नहीं करेगा, तो patient कई बार आता है, patient को watering होती है. Watering क्यों होती है? Because the lacrimal pump mechanism is not working well. That's why the patient is having watering from the eye. This orbicularis oculi is basically divided into two parts, palpebral and the orbital, and the palpebral part is then again basically divided into two parts, that is the preseptal and the pretarsal. You do not need to go into too much of anatomy of the orbicularis oculi, just showing you here so that you can get an idea. So this is the big muscle which is very near to the orbital bones. This I call it as the orbital part, and here which is near your palpebral conjunctiva, I call this part as the palpebral part, okay, of the orbicularis muscle. Chalo. Then I would tell you a bit more about the orbital septum. So orbital septum, which I told you is beneath your orbicularis oculi. Okay, so if this is your orbicularis, then we have the gray line, and beneath it we have a multi-layer tissue, a fibrous network, which is called septum. So why this is important is it basically is providing the structural framework or toughness to the eyelid. Eyelid does not sag. Why it is not sagging? Because of the septum. This arises from the periosteum of the superior and the inferior orbital rim. Okay, so what is the basic function of the septum? Septum provides the framework for your eyelid to be firm. Okay, so though it is a very thin structure, it does not have any bone, still it is firm because of your orbital septum. What are the various things, various vessels and the arteries which are passing through the orbital septum? Just remember the name. As the name suggests, you can have the lacrimal vessels and lacrimal nerves. You can have supraorbital vessels and supraorbital nerves, supratrochlear vessels and infratrochlear vessels, superior and inferior palpebral arteries, aponeurosis of the levator palpebrae superioris in the upper lid, and the expansion of the inferior rectus. Then we can have anastomosis between the angular and ophthalmic vein that also passes through the orbital septum. These are the things which unfortunately you just have to cram, because they can basically ask you that which of the structures is not passing through the orbital septum. Okay, so just remember what are the structures that are passing through the orbital septum: lacrimal vessels, supraorbital vessels, supratrochlear vessels, infratrochlear vessels, superior and inferior palpebral arteries, aponeurosis of the levator, expansion of the inferior rectus, and we have the anastomosis between the angular and the ophthalmic vein. Then what are the retractors? Retractor means which of the muscles are opening the eyelid. So for the upper lid, we have the maximum opening caused by the levator palpebrae superioris, and a small action is also there by the Muller's muscle, which is also called superior tarsal muscle. For the lower lid, it is the capsulopalpebral fascia and the inferior tarsal muscle. Okay, so remember, another name of Muller's muscle is your superior tarsal muscle. Why it is important? Because we would study about a surgery which is called Muller's resection. Muller's resection is basically used when we have a mild ptosis. Okay, then I told you about the septum. Then the next tissue is the tarsal plate. So tarsal plate is basically the firm dense plates of the connective tissue which serve as the skeleton of the eyelids. Then I told you about the medial canthal tendon when I started the session. So medial canthal tendons are basically maintaining the configuration of the palpebral fissure by attaching these eyelids to your tarsal plates and the bones. Okay, what are the various venous supply of the eyelid? So pretarsal, they medially drain into the angular vein, and laterally they do drain into the lacrimal vein. Post-tarsal, they basically drain into the orbital vein, deep branches of the anterior facial vein, and the pterygoid plexus. Pterygoid plexus. Okay. Then what are the various glands of the eyelids? I told you the meibomian glands, which are so much important in the internal hordeolum and chalazion. They are basically modified sebaceous glands. Then I told you about the glands of Zeiss, which are opening directly into the eyelashes, which are also the sebaceous glands. Then I told you about the two glands, which are the glands of Moll and the glands of Cross and the Wolfring. The glands of Cross and the Wolfring, they are the accessory lacrimal glands, and the glands of Moll are the modified sweat glands. So if you can see here, these are the glands of Zeiss which are opening into the eyelashes. We have the meibomian glands near the tarsal plate, the glands of Wolfring and the glands of Cross, that are the accessory lacrimal glands. Okay, chalo. Let's move to this. So this is all we should basically know about the lid anatomy. So before I end the session, there is a quick recap of what I told today in the eyelid anatomy. So eyelid basically which acts as a shutter, make your facial features, spread the tear film, and also make the nasolacrimal apparatus. In the eyelid, you should be knowing about the various parts of the eyelid, the superior eyelid and the inferior eyelid. The superior eyelid basically covers 2 mm of the cornea. You have the eyelashes there anteriorly. We have the medial canthal tendon and the lateral canthal tendon. We have the inferior lid crease and the superior lid crease. Then we talked about the various layers of the eyelid from the superficial to the deep. We have the skin, subcutaneous areolar tissue, orbicularis oculi, orbital septum, orbital fat, retractors, tarsal plate, and conjunctiva. We talked about the various lines. We talked about the gray line, the structures anterior to the gray line, the structures posterior to the gray line. We talked about the various glands, the structure of the superior and in the inferior eyelid. We talked about the skin, which is the thinnest in the body. And we have the subcutaneous areolar tissue. Then we have the protractors, which are the orbicularis, Orbicularis has two parts, the pretarsal and the preseptal, and we have the orbital septum. The structures which pass through the orbital septum are the lacrimal vessels, supraorbital vessels, supratrochlear vessels, infratrochlear vessels, superior and inferior palpebral arteries, aponeurosis, expansion of the inferior rectus. Then we have the retractors like levator and the molars in the upper lid, and the capsulopalpebral fascia in the inferior tarsal muscle in the lower lid. Then we have the tarsal plate, the medial and lateral canthal tendon. The venous supply is by the angular vein and the lacrimal vein in the pretarsal region. In the posttarsal region, it is supplied by the orbital veins and the deep branches of anterior facial vein and the pterygoid plexus. Lots of glands there, meibomian glands, glands of Zeiss, glands of Moll, and the glands of Wolfram. So with this, I end the session of the eyelid anatomy. Thank you, and subscribe for our channel, that is the Let's Crack NEET PG.